Sorry, I'll do a better job of turning it. What else do we have here? We have a part of this wall right here in between the two atria that's a lot thinner. It's a vestige from fetal development. What is that? Fossa ovalis. It's an oval fossil. It's a thin portion of the wall between the two atria. All right, so then we're going to go, oh wait, there's one more thing bringing blood into here. We already said the superior and inferior vena cava. There's one more thing that puts blood into the right atrium.
Coronary sinus.
Coronary sinus, where is it? Right there. This is the coronary sinus. All the veins of the heart all drain into here, and then they go back through here. And remember when we looked at the fresh heart, we could actually stick a pointer from the right atria into this coronary sinus. It's a nice open vein on the back of the heart. Okay? All right, so where do we go from the right atrium? Through the tricuspid, exactly, or the right AV valve into the right ventricle. All right. What is this stuff, this meshwork right here? Trabecular carne. What's one thing that we would only see on the side of the right ventricle?
Moderator band.
The moderator band, right? This this thing doesn't have good papillary muscles, but how would you tell that you were looking at a papillary muscle? Would be connected to a chordae tendae. You would see these little white cords right in here, sitting right on top of a muscle that juts out to them. That's how you tell you're looking at a papillary muscle. Right here we have some branches. What are these guys?
Spinal branches.
Spinal branches, and then they transmit the signal to these
Purkinje fibers.
Purkinje fibers. Awesome. What kind of valve is this? Semilunar, right? There are 3 little cups. And where is this leading to? To the pulmonary trunk. All right, so that makes this the pulmonary trunk, and it's going to split into right and left. Pulmonary arteries or veins? Arteries. Why?
They're leaving the heart.
Because arteries go away. Exactly. They're bringing blood. Is this blood oxygenated or deoxygenated? Deoxygenated. Okay. As we are heading out, what's this little structure that connects the aortic arch to the pulmonary trunk? Ligamentum arteriosus. Exactly. It's another one of those vestiges from development. Okay, so now blood went to the lungs and it did its thing, and we're going to learn what its thing is in the next bit of thing. And now it comes back, and we come back into these 2 vessels and these 2 vessels. What are these guys? Pulmonary veins. Okay, and they give us.
To know the right and the left pulmonary vein.
On vessels, always put right and left. Always put artery or vein.
So on the semilunar valve, would you want us to put semilunar or pulmonary semilunar?
Put pulmonary semilunar, or you can put pulmonary valve, because that's its name. But if you say semilunar, it's like a kind of valve.
Yeah.
It's like if I said a wrench. Well, what kind of wrench? Are there many kinds of wrenches? Solid.
A screwdriver.
I know there's a Phillips one and there's other ones. That's all I know. All right, so we have a left auricle, and in the left auricle we have the left pectinate. Okay, how do we go from here into here? The bicuspid. What's another name for it? Mitral. Okay. And this is the trabecular carne. Also don't have good papillaries on here. Okay. Blood will then go through here. What is this valve? You can barely see it, but it's a semilunar. Aortic semilunar into the aorta. And before the blood gets into the aortic arch, it's going to go somewhere else. Where will it go? To the heart. It's going to feed the heart itself. And you can see really well in this model, you can see we have the right coronary vessel right here, coming out of the heart, going around the right side. Okay? This one is going to go around. It'll give us a little marginal guy here on the side. And then the important vessel that it gives in the back is the posterior intraventricular, because it's in the back, in the spot where the 2 ventricles meet. Really, if you thought about where the intraventricular septum was, and it's the artery. Okay, so we got the intraventricular artery. Oops, sorry, here. We have another coronary vessel right here. It's the left coronary. and it gives us the anterior intraventricular artery. And then it goes around the back. And when it goes around the back, it's the circumflex. In terms of what you need to know for the veins, here in the front, you have the great cardiac, and then you need to know coronary sinus, and that's it. You're okay with those two veins on coronary circulation. You're gonna fall. Okay. All right, so what about the branches off of the aorta?
Right brachial carotid, left common carotid,
Left common carotid, left subclavian. Why is there?
It branches.
It branches, right? It's going to give us these two vessels, but it's going to branch. So they share a trunk. All right. So find other things that you may not remember. Look at the circle of Willis. If you're having trouble with it, I'll come help you. Start put it all together today, and then put it together more on whatever next day we need, and then practice.